Hello, my name is Trina Ganguly, and the date today is May 24th, 2023. Today I'll be discussing various topics and their definitions and examples. To begin with, the definition of disease refers to the description and understanding of a specific pathological condition or disorder that affects the normal functioning of the body. It involves identifying the characteristic features and manifestations of the disease. For example, diabetes mellitus is a disease characterized by high blood sugar levels resulting from the body's inability to produce or effectively use insulin. Second, disease classification involves categorizing different diseases based on their shared characteristics, causes, or symptoms. It helps in organizing and grouping diseases for better understanding and management. For instance, cancers can be classified into different types, such as breast cancer, lung cancer, and colon cancer based on the affected organ or tissue. Third, is etiology, which refers to the study of the causes or origins of diseases. It involves identifying the factors or agents that contribute to the development of a particular disease. For example, smoking tobacco is a well-known etiological factor for lung cancer. Next, pathogenesis describes the biological mechanisms and processes involved in the development and progression of a disease. It focuses on understanding how the disease originates, spreads, and affects the body. For instance, the pathogenesis of atherosclerosis involves the buildup of plaque in the arteries, leading to reduced blood flow and increased risk of cardiovascular issues. And symptoms are subjective experiences reported by individuals that indicate the presence of a disease or condition. They are what the person feels or describes about what they're going through at the moment, physically, depending on their health. For example, cough, fever, and fatigue are common symptoms of the flu. Next is signs, which are objective observations made by healthcare professionals during a physical examination or through diagnostic tests. They are measurable or observable indications of a disease. For instance, a rash, elevated blood pressure, or abnormal heart sounds can be signs that frequently occur together and suggest a specific disease or condition. It represents a recognizable pattern of clinical features. For example, Down syndrome is characterized by a combination of physical features like facial abnormalities, some intellectual disabilities, and certain medical conditions. Also, diagnosis involves determining the nature and cause of a disease or condition. It is based on evaluating the patient's symptoms, signs, medical history, and the results of a diagnostic test. For instance, a diagnosis of pneumonia may be made based on symptoms such as cough, chest pain, and fever, along with findings from a chest x-ray, which will show that there is signs of pneumonia. Next, complications are additional health problems or adverse outcomes that can arise as a result of a disease. They may occur during the course of the disease or as a consequence of a treatment. For example, diabetes can lead to complications such as diabetic neuropathy or retinopathy or kidney disease. And prognosis refers to the predicted outcome or course of a disease. It provides information about the expected progression of the condition and the likelihood of the recovery or long-term effects. For instance, the prognosis of a person with early-stage breast cancer is generally more favorable compared to someone with advanced-stage cancer. And finally, diagnostic tests are medical procedures or examinations used to confirm or exclude the presence of a disease. These tests help in assessing the patient's condition, identifying the underlying cause, and aiding in the diagnostic process. And examples of diagnostic tests include blood tests, which show the complete blood count of the patient, imaging studies, which could be x-rays, MRI, and others, and biopsies. Thank you.